During my patient's running gait video, I noticed that she was experiencing some collapsing in her right knee in loading response. She was also experiencing some circumduction in her feet during mid-swing and terminal swing. What this means is that during the swing phase of her gait, or when her leg is coming back to the front, her leg kind of goes out to the side before returning to the front. Additionally, it looks like she isn't getting full extension in her left knee during her running. It just looks very stiff. The patient has mentioned that she gets pain in the front part of her shins. So muscles that could be causing these gait deviations and pain for collapsing could be weak quads, weak glutes, and tight hamstrings. Knee collapsing is the result of too strong of a hamstring or adductor magnus overuse to compensate for glute max weakness. This causes the hip to go more inwards, which is known as adduction. This inward motion can further exacerbate the patient's medial knee collapse, which I know that this patient has a problem with her medial knee and just having pain there normally. This could also be the potential cause for her shin pain, as now the forces through the knee are changing and causing more distal muscles to compensate for that medial collapse. For her circumduction, some muscles that could be contributing are weak abductors, tight adductors, and weak hip flexors. Circumduction of the hip occurs during swing phases, and a lot of this it can occur for several reasons, including weak hip flexors, contralateral hip dysfunction, or leg length discrepancy. This is a combination of hip hiking, forward rotation of the pelvis, and abduction of the hip. So to help improve my patient's running gait, I want to give her 3 exercises that would help her improve her glute strength, her hip flexor strength, her abductor strength, her core, and to stretch her tight adductors. The first exercise is a hip stretch that is going to focus on opening up the hips and really stretching those hip abductors or adductors. The second exercise is called monster walks to help overcome those tight hip abductors. The second exercise is called monster walks, and I want to strengthen her hip abductors to overcome her tight hip adductors. And then her third exercise is called floor slide mountain climbs, which will focus on strengthening her core, her hip flexors, her glutes, and her quads. Here are the videos. The dosing for this stretch, I would have my patient do 2 to 3 times a day for 20 to 60 second holds, probably multiple times throughout the week, maybe even once a week at least. And this is just to really help stretch her adductors and her internal hip muscles here, just to kind of help with that external rotation. And this will really help loosen that up and keep you from circumducting so much while you're running. This exercise / stretch, what I'm gonna go ahead and have you do is I want you to get up onto your knees on the mat, and then I want you to kind of spread them as far apart as you're comfortable. And I want you to bend forward and put your elbows on the mat as well. And I want you to just kind of lean into that stretch into your hips. You can spread your legs or your knees out a little bit more if you need to. Make sure your legs aren't, or your heels and your feet aren't touching. And then you can I'm going to have my patient Morgan here do monster walks, which will help strengthen her abductors since she does collapse in a little bit, and she does do some circumduction while running. So I'm gonna go ahead and demonstrate for you what these monster walks look like. She's gonna have a band above her knee, and I want her in a nice squat like this. Bring your feet together, step apart, okay? Make sure there's a nice stretch there at that end. Okay. So for this exercise, for this dosage, since down and back would be considered 1 lap, I'd have her do 5 laps, probably about 3 times with some rest in between. And then I want her to do it three to four times a week. Before I get into position. All right, so your next exercise is something called floor sliding mountain climbers. Basically what that's gonna be is, if you're familiar with normal mountain climbers, instead of raising your foot up off the ground, you're just gonna slide.
Okay.
The target of this exercise is to hopefully strengthen your hip flexors and your quads while engaging your core.
Okay.
This will help again with the collapsing and hopefully with the circumduction that we see in your running gait, okay?
Alrighty.
All right, so I'm gonna go ahead and have you get into a plank position. All right, and I want you to bring your left leg up and bring it down. I'll bring your right one up. All right, now do it together. All right, you can go ahead and stop. So for this exercise, I would have her do this for maybe about 30 seconds, 45 seconds. I would like to see it done 2 to 3 times a week, maybe 4 times. But yeah.